Hello, and welcome to the third of our Dean's video reports. I trust that you've enjoyed the previous ones, and as promised to you in my last one, we're going to talk today about a new initiative from the Schulich School of Medicine and Dentistry, as well as from the University of Western Ontario, directed towards the creation of a School of Public Health. So many of you may be wondering, why exactly do we need to have a School of Public Health here? It's something that's transpiring across North America, and there's going to be a great need for new students, new trainees who have had this expertise in understanding public health policy, health delivery, and the economics of it. So if you look simply across the border with the initiatives that President Obama have brought in, it's predicted that there's going to be between 10,000 and 20,000 new jobs appearing in the very short time frame to help deal with all of the initiatives that the new funding programs have brought about. Individuals who understand the development of health policy, who understand how the economics of healthcare are delivered and how to evaluate these in the long term. So it's been a huge area of growth, but it's not new. Schools of public health have been around for a considerable period of time, and when one looks, for instance, to the Johns Hopkins School of Public Health, it's been around for almost the last century and is internationally recognized for that. Why would we need to do one here in Southwestern Ontario then if these already exist elsewhere? Well, there are several good reasons for it. First, when you look at the demographics of Southwestern Ontario, we are highly reflective of the rest of Canada. You may not believe this, but when you look at our boundaries, the School of Medicine and Dentistry subserves the entirety of the Southwestern Ontario region. Our university is poised with strengths on the economic sides, on health service delivery side, on a distributed education network which can be used towards research. And we have huge strengths with our partnerships already existent at the University of Windsor and those that are developing at Guelph and the University of Waterloo for us. So as a region, we have the capacity to ask these types of difficult questions as how are we actually expending the dollars which are limited in an aging population for that? More importantly, because we do represent a mosaic of the populations across Canada, save perhaps those in the Northern Territories, we have the capacity to ask questions and answer them that will be useful to healthcare policy across Canada for that. When the politicians in Toronto are making decisions with regards to health policy that are based in Southwestern Ontario, we should actually have a strong input in explaining how those would impact us and actually in the development of those policies. So as a fundamental ability of our school to participate in that, this is going to be absolutely critical for that. A second piece to this, however, is that we are functioning in a milieu where we are research intensive. And the Canadian Institutes of Health Research, so CIHR by any other name, is very clearly establishing that we must move towards understanding how our basic science research translates into new health policy and economics. These are called Pillars 3 and Pillars 4 of the CIHR mandate. They've been reaffirmed over the course of the last couple of years, and clearly will be aspects that are critical to us to develop. So it's not just sufficient to be excellent in our research capacities, which we truly are. We have good areas in some of our health policy. We need to move to excellence. We need to move to the point where we're recognized as having this capacity. It will be of a tremendous assistance to us at multiple levels. So we're going to be moving forward on that front with it. It's a program that hasn't just sprung up out of the ground without any background work. I have 3 people that I'm deeply indebted to who have been working hard on this program. The program itself will enter its first students in September of 2012 at the master's degree level. We anticipate that within a year or 2 following that the doctorate program will also be initiated. This program got started with Bertha Garcia and Jack Bend from our faculty working very hard on the geographic scan to determine, is this something that we could do? If we're going to do it, how will it be unique? What are the types of courses that we will need to offer? Amardeep Thind from our Epidemiology and Biostats program has joined them and has been working tirelessly as a group of 3 to develop this. Almost 100 individuals from across our campus took a Saturday and focused on the development of this program and what would the courses look like and what would we try and achieve. That speaks to an incredible amount of dedication and interest in the development of this. And I can tell you, these were individuals from across our Windsor campus, the University of Western Ontario, clinical scholars who are involved in healthcare delivery from our hospital sector. This was not an isolated event just by the Schulich School. Even though we're going to be leading it, this is truly an interfaculty and interdisciplinary program for it. I have no interest in seeing a program that's offered that is the same as what we see everywhere else. This has to be a demand program for our university. And to do that, we have to be innovative. So you're going to see innovation on a couple of different fronts for this. But the greatest one will be what the course material actually looks like. As far as we can see, this will be the only course or program in Masters of Public Health which will be case-based. So that means that rather than didactic lectures, very much like the School of Business, so the Ivy School does, we will use case-based programs, and indeed we will be building on their experience to do this. It'll also be unique in that we are going to be aiming for accreditation. That is an unusual thing to get, although it's often the aspiration of a program. In Canada, there are only 2 that we know of that are accredited on the American standards for this. We have to do that. It'll take 2 or 3 years, but it means that we have to offer a core program, and that core program will be dealt with for it. If you're an alumnus and you're listening to this and you're wondering, how could I participate in this? Well, what has amazed me, and should never have, but it did, is the absolute strength we have amongst our alumni in a whole variety of areas of healthcare delivery. If you have strengths in that, if you're involved in public health programs and want to provide input, I would love to hear from you, but I know that Jack, Bertha, or Amardeep would as well. Simply correspond through our emails. We'd be happy to hear about your suggestions and incorporate them if they're going to be of assistance to us. If you're looking for an opportunity to financially support our school, and there are going to be multiple as we develop aggressively over the course of the next decade, as I've spoken before, we are building a new facility. We have to expand our teaching capacities. One aspect of this will be to encapsulate the School of Public Health within this new facility. We would love to hear from donors who would like to see this as a naming opportunity for a school. On a different note, this is now the beginning of the holiday season for everybody. So for my wife Wendy and myself, my 3 children, we'd love to wish you a happy and a safe holiday season. This has been a year of tremendous change for me and my family. I can safely say that I am not doing what I thought I'd be doing a year ago from now. This has been a tremendous change. It's been enjoyable, it's been a tremendous challenge, but the people that I've met, the willingness to move forward, the environment in which we work is just fantastic. It's a real honor to be doing this. And I'm sure as you look back over the course of your last year, there are things that have been great and maybe not so great. It's the time to reflect on those, to think back and have a safe holiday season. So again, from my family to yours, we wish you the best of the holidays. Take care.